Good morning, everybody, and welcome to the Vestibular Disorders Association's Making Vestibular Visible live event, brought to you by Vertigenius. My name is Kyler Southcott. Our original interviewer was unfortunately not able to be here this morning, but I have the honor of continuing this interview with our guest, Dr. Dara Meldrum, the founder of Vertigenius, which is an innovative new medical device. So today we are going to be discussing the remote treatment of dizziness and imbalance using a novel virtual platform called Vertigenius. It is a comprehensive and personalized approach to vestibular rehabilitation that empowers patients to effectively engage with their prescribed exercises. And so I have the great honor of introducing Dr. Dara Meldrum. She is a vestibular physiotherapist with over 25 years of clinical and research experience. She has published 53 journal articles and over 100 conference abstracts. Her doctoral research is mostly centered on the integration of technology in balance and dizziness rehabilitation, which led her to found Vertigenius, an online, comprehensive, and personalized approach to vestibular rehabilitation. So welcome and thank you for being here, Dr. Meldrum.
Thank you very much. It's a real honor to be here today. Thank you for having us.
Absolutely. Thank you for being willing to continue with this interview and for being here today. So I would love to just kind of dive right into things. I know that everyone here is super curious to hear from you. So I'd love to start off with you just telling us a little bit about your professional background and kind of how you got to developing Vertigenius and what that looked like for you.
Sure. So yeah, I'm a physical therapist, as you said, or as they call us over here in Europe, physiotherapist. We've a slightly different title. I'm an associate professor in the School of Medicine here in Trinity College Dublin, and I'm the inventor and founder of Vertigenius, which is what we're going to be talking about today. So I both lecture and research in vestibular rehabilitation, and I'm also a clinician. So I practice in the Balance Centre in Dublin, where we treat dizziness and balance patients. So that's sort of the background in terms of what led me to today. My career history, I graduated from physical therapy school in the 1990s, so a long time ago now, and I really kind of cut my teeth, got all my initial experience in Ireland, and then moved to Canada for a year and got really interested in neurosurgery. I worked in a neurosurgical hospital in Ontario and really was very interested in the plasticity of the brain and how we can help people relearn activities and how the brain recovers neuroplasticity and the best kind of ways of giving exercises and programs to patients. So I returned to Ireland then and took up a post in a neurosurgical hospital in Ireland, and then went over to London and did a master's in neurorehabilitation, where really sort of cut my teeth on research then and got very interested in researching this area. So I was very fortunate then to come back to Ireland and get a job where I was treating patients and researching at the same time, kind of clinician scientist, as we call them, in one of the major teaching hospitals here in Dublin. And that was really where I started to see the referrals coming in for dizziness and imbalance. We were starting to see lots of research coming out of the States about how we knew vestibular rehabilitation worked, how the brain can learn, how the brain can recover from dizziness and balance disorders. And I was starting also to see a kind of a technology starting to develop as well, and new technology coming into departments. So worked with ENT colleagues and neurology colleagues to build a vestibular rehabilitation service within one of the first in Ireland, I believe it was. And we just saw it growing, and we saw what we're seeing now today. You know, these are huge problems. Lots of people need access to this treatment. It's a complicated route to get treatment. Treatment works. So that really got me thinking, how can we best solve these problems, and can technology help us to solve the problems? So that's so currently I'm still researching, developing Vertigenius, using it all the time with patients. And yeah, we're just hoping to get it out to the broader public and to the broader patient population so that we can help them with their treatment.
Absolutely. It sounds like a fascinating tool and that something that is going to help a lot of people get connected with clinicians that can actually help them. So I understand that your doctoral research was kind of centered on the integration of technology in balance and dizziness rehabilitation. And like you mentioned, you've kind of seen this develop over the last few years as as we've understood balance better and tried to get this treatment out to more people. Can you tell us about a little bit about your doctoral research and what you did then?
Yeah, so what I really wanted to do was combine this problem of vestibular rehabilitation. How can we get treatment to our patients? You can go on actually to the next slide and just this, yeah, this one exactly. So I knew we were giving exercises to patients at home. I knew that we didn't have really knowledge of what was happening when patients were at home. So we didn't have, I was just be envious of my physician colleagues who could inject a drug into a patient and then see the effect, whereas we could give an exercise program for a patient and we didn't really know what was happening when they went home. And we know that vestibular rehab, a lot of it is done at home because it needs to be done regularly and in little short, sharp phases throughout the day. So at the time, around the time I was thinking about doing my doctoral studies, the Nintendo Wii Fit Plus came out, and you can see it up here on the screen. So when I looked at it first, it just really blew me away because it had this force plate that could show the wobble, so you could see where your center of pressure was going. It had games, it had lots of all the things that we want in vestibular rehabilitation. So getting people to move their heads, move their feet, change direction, shift their weight. Not so much maybe about gaze stabilization exercises, but just lots of stuff there that we could actually put into the home. And when the patient brought the Wii back, we could see what they were doing. So I really was thinking, gosh, I wonder what could we learn from this, and what would patients think of it if we started to give them tech in the home to do their rehab. So I was really fortunate to team up with a supervisor, Professor Susan Herdman. I'm sure a lot of your audience will know her. She worked in the Emory Balance Centre, and I had her over here in Ireland doing courses with it. So she agreed to supervise my PhD, and I spent some time with her in Emory. And we went through all the things on the Nintendo Wii Fit Plus, and we designed a randomized controlled trial. If you want to go on to the next slide, where we divided people into two groups. So we gave one group a Wii to go home with, a balance board, and also a little kind of rocker board that went under the balance board as well, so we could get that important wobble in during later exercises. And then the second group went home with just our conventional stuff, which was like a balance mat and a ball, and then both of them got booklets as to what they were to do. And we progressed it. We tried to standardize as much as we could, and then we progressed them through a 6-week program. And the patients that came into the study were very defined. They were patients with chronic problems. They had never had vestibular rehab before, and they had a unilateral vestibular problem. So just one side had been knocked out by neuritis or something like that. And what we found with the results with the study was that the outcomes actually were fairly similar, which was a surprise to me. I was absolutely convinced that Nintendo Wii was going to be much, much better. But what we did find was that we learned an awful lot about the patterns of exercises, because when they come back in with the Wii, we could download and see what they'd done, how much time they'd spent on it. We could get feedback with them, could interact with them. And the other thing was they absolutely loved it. So the ratings of enjoyment for the Wii were significantly higher than they were for the conventional exercises. And that brings us to this problem of we can't always make these exercises interesting for patients, right? So that really kind of whetted my appetite. Now, it wasn't fit for purpose, the off-the-shelf Wii. It's not really available anymore, I don't think, actually, in its current format. So I knew that we probably needed to develop our own bespoke system. And I teamed up with some computer scientists in Dublin, and I said, what we really want to do is track the head, because it's the head that makes the movement of the head that makes people dizzy, but it's also the treatment. So we need to understand what's going on with the head. So we know about balance, but we don't really know about the head and gaze stabilization exercises as much. So can we do something with that? And can we develop something that's actually bespoke for vestibular rehabilitation? So that was how my doctoral research led me to developing Vertigenius.
That is fascinating. Thank you so much for telling us about that. Something that you mentioned is that, patients were finding it a lot more enjoyable, finding the exercises more enjoyable when they were doing it on the Wii. And so how has that how have you kept that, and how has Vertigenius led to solving some of the problems that people can have following through on their exercises.
Yeah, so I think if you just go on to the next slide, I think in the broader context, before we get through to kind of the problems, we have a large problem with balance and dizziness globally. All right, it's not just discrete. It spans ages, it spans different specialities in medicine, and one of the things that we've learned very clearly is that individualized treatment is best. All right, so you can't just give a generic program to a patient. You really need to focus on what their specific problems are. Move on over to the right then, we know waiting lists are long, there aren't enough physicians, there aren't enough physiotherapists. So is there a way we can improve access by using technology? So technology allows you to access your treatment without a therapist necessarily having to be there. It needs some therapist input, but can we use technology to get people off waiting lists, to get them through treatment? And we also know that early treatment is better. Okay, so not only in terms of maybe getting better plasticity in the brain and better outcomes down the line. It seems now, we think that if you get there early, you start treating early, you actually have a different outcome in terms of the neuroplasticity in your brain. It's still very early research, but that's kind of the current thinking. And also, we don't want people getting chronic. So things like 3PD or chronic subjective dizziness or whatever way you want to term it, we think that maybe if we got people earlier and managed them better at that point, we would stop those chronic problems from occurring. And in terms of the public looking for treatment as well, when we looked at search engine metrics from Google, 550,000 per month on for the search term, how to treat vertigo. All right, so really big problems out there. And we surveyed in Europe, through a research network I'm involved in, therapists about all their experience with vestibular rehab, and 50% of them were saying it's just hard or very hard to access in their countries. This was across about 19 countries in Europe. So that was kind of the bigger context in terms of how technology might be able to help. And then coming down to the individual experience of the patients as well. So yes, we knew that tech helped them, but we didn't take it for granted. So we first of all went and talked to our patients. If you want to go on to the next slide, we asked them, are you having any problems with this treatment that we're giving you? Now, a certain percentage of them said, no, not having any problems at all. It's all fine. They're easy exercises. But a lot of other ones said things like this. They said, look, they made me feel unwell. That was the biggest complaint. So moving my head around, you're telling me to move my head around, but you're making me feel really sick with it. And I don't know what to do when I feel really sick. Do I change the exercise? What do I do? So I don't know how far to move my head. I don't know how fast to move my head. I find it hard to be motivated to do them. I find it hard to remember to do them. And I'm unsure how to move my head. So there was lots of stuff that was coming back that we thought, there are problems here that we think we can fix with technology if we can track the head during treatment. And a really interesting paper just came out this year by a researcher called Calderon, and he sat down with a group of patients and therapists and said, what are the barriers and facilitators for you doing your vestibular research or your vestibular rehab, excuse me. And they came up with the same sort of things. It was the motivation. It was feeling like my symptoms are getting worse and I don't know what to do. When I do the exercises, I feel worse. It was feeling like it was the reminders. It was the feedback. It was all that sort of stuff. Exactly the same as what we had found. And we also wanted to talk to therapists. So if you want to go on to the next slide, we talked to therapists as well. And we said, what's important for you when patients are doing exercises? Do you need to know what they're doing? And they said lots of really interesting stuff to us, like, we're kind of working in the dark. If they come back and they're better, we don't know whether it's because they've done their exercises or they were getting better anyway. And if they come back and they're worse, we don't know whether it's because they didn't do their exercises or we gave them the wrong thing to do. And it was just viewed as a really critical parameter that to connect the patient to the therapist at home was really important for therapists to know, as well as patients to feel supported. So that was really what we set out to try and when we were trying to solve all these problems when we were building Vertigenius. So if you want to go on then to see what we actually built, get to the crux of it. We wanted, I had a couple of from all that, if you want to go to the next slide, what I wanted to do was build something that was simple and quick to use. Clinicians are very busy, patients are very busy, everybody wants to get their appointment done and dusted and go home and start. So I wanted something that was quick to prescribe, quick to use, and simple to use for the patient, so very usable. And that was sort of the criteria, but also that it had to do what it said in the tin, it had to work as well. So what we built was a clinician portal where there were just a vast array of exercises to keep this interest and adherence up for a clinician to individually prescribe exercises to their patients. So they onboarded their patient. They could also send out remote questionnaires to the patient. So what are your problems? What are your goals? Do your DHI online, fill out your symptoms, tell us what you want from treatment. And then before a patient even walks into me now, I can see that. So I can tell, I can go through the DHI, I can go, right, they might have BPPV, I can see what their problems are, I can see what their goals are. That's all done in the comfort of their own home through a link. It comes back into the clinician portal. The patient then has a very simple to use app, which they download from the App Store, and they have a head sensor. And the head sensor, just, I have it here in my hand, it's just very small. It sits on the head behind the ear, and it connects via Bluetooth to the app. So when the patient is doing their exercises, they get feedback as to whether they're doing in the right direction, the right speed, and we also track their symptoms before and after the exercise, which gets, again, sent back into the therapist pretty much instantaneously. So the therapist can see, I've made you better, I've made you worse, you're going too slow, you're going too fast, you're doing it right, you're doing it wrong, you're going the wrong direction. Plus, there's a whole host of other, any sort of exercise. We consulted with a lot of physiotherapists. What are your go-to exercises? What are the best things for walking, for balance? What are the best things for, convergence insufficiency? What are the best things for proprioceptive retraining of the neck? What do you do? And we put them all in with videos. So once the patient gets their exercise prescription, which is always prescribed by the therapist, by the way, there's nothing automated. There's always a human in the middle going, this is what you need to do. And then the patient gets the app at home, and they just literally are taken through their program every day. And all they do is fed back into the therapist. So if they're having an issue with the exercise, it's just a matter of a call or an email to say, and the therapist can look at it and go, oh yeah, I can see that I can see you had a blip here. Did you have a migraine in the middle of all that? And I can see you did no exercises that day. That's understandable, right? You had the migraine, so you needed to wait. So lots of really instantaneous remote monitoring going on, and helping patients and they can set reminders as well, so they can actually they can work out whether or not they're doing their exercises, and they can also see their progress as well. And we can send them out educational materials. So unfortunately, we don't have access to the fantastic Vita materials, but we've written our own that we put through that supplement the information we give them from Vita as well. So that is what that is in essence what Vertigenius does. Now, it's a medical device. It needs to go through lots of rigorous kind of clinical testing and validation, and that's what we've been doing over the last few years. So I think if you go on to the next slide there, might have some information just about so this is kind of what we really need to know before tech, because it's all very well saying we've built this fantastic technology, but it has to sit within the broader healthcare landscape, which is, are people going to fund this? Are they going to reimburse it? Or, it's not just build it and they will come. You've got to make sure that it actually is meeting what healthcare payers, insurers need. And we know there's a move to remote therapy. We know certainly in Ireland, our waiting lists are so long. They're going, if there's any way you can get waiting lists down effectively, you can get people into treatment faster. We're really interested in that sort of thing. So did we get better outcomes? We needed to know. And it doesn't need to be a better outcome in terms of you get much better recovery from it. We know the treatment works when they get the right treatment for the majority of patients, not for all. But does it deliver outcomes for the hospital? Does it improve better outcomes for the patient's pocket in terms of they don't have to go into the hospital as much? Are they feeling better about their treatment because they're more supported? So that's what we were interested in measuring. And we also deliver an improved patient experience. So by using this, are they happier with their treatment? And are they more likely to adhere to their treatment and feel supported and get through it maybe faster? Is it easy to use? So we really needed to make sure it's easy, and also cost. We need to start thinking about how we can get it to patients at a lower cost to what's already happening. That's not the primary outcome for me as a clinician, but it's something that you've got to take into consideration in the context of insurers and reimbursers and things like that.
Yeah, it sounds like that you guys have done an incredible job building a tool that addresses a lot of the concerns that you've seen patients have at home in regards to feedback on their exercises. And, at Vita here on the phones and everything, a question that we get a lot is, I've started these exercises and started feeling dizzy almost immediately. What's going on? And it sounds like you've given patients a very easy way to get that feedback from their providers in a way that, keeps them comfortable and minimizes the amount of travel that they have to do. I do also want to ask, are there any concerns about remote rehabilitation and kind of doing that without face-to-face therapist supervision?
Yeah, yeah, absolutely. I mean, safety is paramount. You know, it's the first consideration. Do no harm. All right, keep people
Mhm.
safe. So, I mean, we routinely therapists give patients to do exercises at home, and they've no idea what they're doing. So it's actually safer, arguably, to give them the exercises at home when you can track what they're doing.
Absolutely.
I am of the opinion myself that there will always need to be face to face. During COVID, we did, you know, experiment with doing over physicians now doing diagnosis over remote because they had to. All right, and I think it's not too bad. We still don't know whether it's completely safe or not, but you know, you need to come in for an MRI or a CT. So there's always going to, I think there's always going to need to be a face to face. And one of the first
Mhm.
things that patients said to me when I was trying out the we did a usability study in the first, and I remember them saying, "Now, Dara, it's not going to replace you, is it? Like, I'm still going to be able to see a therapist. It's not going to be. It's not like you hand me over to some robot Nintendo Wii Fit Plus. I'm still going to have." So I think that interaction is very much valued. But what's very interesting coming out of the research is that
Mhm.
it maybe not be ideal, but the risk of not getting treatment versus the risk of getting treatment remotely is it's much better to get it remotely for the larger population to reduce dizziness and vertigo than to miss a few maybe more serious things down the line. Obviously, ideally, everybody gets to a physician, gets diagnosed. But in terms of the treatment, just again, the research coming out, it is showing that remote therapy is safe, actually. So there's some really nice work coming out of the Netherlands where they looked at a web-based program. One group got the therapist coming to the house twice during the program. One group didn't. They all followed a web-based program. The outcomes were similar. So the
Oh,
effects were exactly the
fantastic.
same, but they were better than patients that were just getting conventional care just with the medical. So it does look like it's safe, but when they dove into the qualitative discussing the programs with the therapist and the patients said they really valued the visit, that face-to-face, seeing the therapist. And the therapist said they really valued getting in to see the patients because patients were changing the exercises and maybe not doing them as effectively as they should. So we're still learning a lot about, you know, what's going to be remote or not remote, what's going to be delivered by an avatar, you know, when there isn't enough physios down the line, what is the future of this? We're learning a lot about that. So I think at the moment, what's best is this hybrid approach where you see somebody, but you're doing your exercises at home and you're being monitored very closely using technology.
Fantastic. And it sounds like there isn't a necessarily recommended ratio of remote to in-person visits at this point. That's still something that they're exploring, but hybrid seems to be the most effective, you said?
Yeah, I think. Well, I think it's probably the preference. Rather, it doesn't. It doesn't. In the studies that I've read, actually, completely remote. They were seen and set up by somebody at the beginning. So I think you're always going to have somebody that's going to, you know, need to set you up on the device and make sure that you're doing the right stuff on it.
Of
So yeah,
course.
I think hybrid for the moment is one of the actually one of the studies that we did where we used it's on one of the slides actually coming up. We didn't really say whether patients were to come remotely or to come in for face to face, and we found that about 64.5% of the visits went to remote using Vertigenius. And when I asked the therapist what did they usually do, they said it was usually about 10% for the patients that they tended to like to come in. But as soon as they knew that they were being monitored at home, what they were saying was they were happier to not come in. It saved them childcare, it saved them taking a day off work, it saved them parking, it saved them time. So they were happy to do remote. But that was on a very small sample. So we've way more to learn about that.
Well, I think that we all look forward to seeing what comes out of that. And I know we've talked kind of a lot about the results and how effective it can be, but I would love to touch on, you know, we have both patients and healthcare professionals in our audience today. And so I would love to hear kind of what can a patient expect when using Vertigenius? What sort of things do they see at home, and what are the benefits for the healthcare professional? You mentioned that they were seeing a certain percentage of their patients from home, and how has that translated into effectiveness? And I'd love for
Yeah.
you to.
So if you just want to go on to the next slide, we're really, we're just really interested to know that this is working and that patients are getting the best care that they can get, and that we're improving care if we can. So the first study we did, it was during COVID that we did this. So we weren't able to get into the hospital with the head sensor. So the patients used the app and the clinicians used the portal, and they literally, some of the patients did not even come into the hospital at all because of COVID. So we looked at, if you can see the bar there, we looked at how patients and therapists rated usability. And we use this scale called the system usability scale. It's called the quick and dirty usability scale, and it's 10 questions, and you're asked things like, I'd like to use this system often, it was too complex, I needed a lot of help before I got going on it, that sort of thing. And then we interviewed patients about what they thought. And you can see that our scores were up there for both therapists and patients, the usability was very high. And then the outcomes you can see over there on the right-hand side. So you can see that's each patient before and after. You can see that line is the line between the two dots is the patient before and the patient after. So we measure these symptoms every day. The patient just puts a snapshot, how do you feel today? And they just do a numerical rating scale of their nausea, their dizziness, their imbalance, their oscillopsia. And we see that tracked over time. So it's really nice. You can see people getting worse or getting better or how they're getting on. So we found that between the first and the last time point, we found significant reduction. All right. So 50% reduction in symptoms, and 82% of patients actually improved their symptoms. This is in line what we would expect with, conventional care as well. So we just wanted to make sure that we were on track with all of that. And really positive, I think positive endorsement of, particularly during COVID times, as you can imagine, they actually had the treatment in their pocket at home. So that was the first thing we did. And the second thing we did was we looked at a population of patients with MS, so multiple sclerosis. So this, as we know, is a neurodegenerative disease, and patients get a lot of balance and dizziness problems with this. So if you want to go on to the next slide, we this time the patients went home with the head sensor. So they had the head sensor, they had the app, and they actually might need to just click on the, we don't have the full scores on the slide there. So we again looked at usability, and we looked at, we used a different questionnaire with this. It's called the Service User Technology Acceptance Questionnaire. So like, how do you feel when you get kit? So you get a head sensor that you've got to, turn on, put it on your head, put it in your pocket, take it out again. How do you feel about that? How do you feel about the security and the privacy of, of the people that are looking at the data? How do you feel about the privacy of your data in any sense of the word? Are you satisfied with it? Would you give it to somebody else? And does it substitute for care of a health care professional? So the bars aren't showing up there, but what we found some really interesting stuff. They were very satisfied with it. They said that patients with MS should be offered this treatment. They weren't concerned about the data privacy, all right, of the security and data privacy, which is an interesting thing. We don't really know that much about that. And I think people are getting a lot more. Healthcare data is a special type of data. It's very carefully managed, but they didn't seem to have concerns about that. Where they were a bit equivocal was the kit as substitution. So it was like, do you think this would substitute for your care with the professional? They kind of dichotomized into half of them said, actually, it's doing a pretty good job of managing me at home. And half of them said, we need the therapist as well. So again, just very interesting learnings for us as to how we interacted. And with the head sensor, what we could see is that over time, the patient's dizziness was going down and their heads were moving faster. So they were able to do an awful lot more movement while their symptoms were reducing. And that's really what we wanted to do. So that was, and again, small sample, we need to flesh this out an awful lot more in future trials. But we probably have over 1,500 patients have used it to date within Ireland and the UK. So it's growing. So we're learning a lot more as the data set grows.
I'm curious, have you seen any sorry.
No, go on. I was going on to the second part of your question, but go on. Yeah.
I wanted to ask if you had seen any correlation between those that found it more useful and folks that were consistent with following up their exercises at home, and whether there was correlation between those.
Yeah, that's a really good question. Excellent question. And it was something I was really interested in. Unfortunately, we didn't have enough people in the study to look at that correlation, to the adherence and outcome. research would generally suggest that if you do your exercises, you get better. All right. So, but what we're not sure about, and we're really not sure about it, is the dosage. We're just not sure whether we're overdosing people or underdosing people. And that's something that this technology, I think, will solve in the future, because we can see exactly what people are doing. If they're wearing the sensor, it's measuring their head, it's measuring what they're doing. So we know. And I think that, you know, it really, and actually one of the things that came out of that study I was talking about, where they asked patients about the barriers and facilitators, one of the things was, I actually got better. And then I didn't need to do the exercises anymore. So patients also have different rates of recovery. Some will get better. And then you're going, well, you didn't do your exercises and you got better, but they were just having a different rate of recovery. So there's lots of different variables we've got to think about when we're looking at the adherence factor. In my experience, vestibular patients, I'm sure you've got a few listening here, they are really good at doing their exercises because they feel so miserable and they want to get better. So adherence is not always the issue. It can be an issue with some people, but it's not always the issue. I think we need to learn a lot more about dosage first before we can answer those questions. But I was just going to come to your question about what can a patient expect and what can a therapist expect, the second part of the question. So if you want to go on to the next slide there, this is what a clinician can expect. So we think that it will help to accelerate the treatment, okay, that they'll be able to onboard patients. You can collect a lot of the data a lot more quickly. And we also think that they will be able to get exercises out. So no more messing around with pen and paper and all that sort of stuff. They can get exercises out an awful lot more, a lot quicker to patients. They can, so what they do is they can just drag and drop a program over really fast when they're giving an exercise, and they can individualize every parameter. And any exercise that they want to prescribe, more or less, I think we've got most of them on there. We've some to add in there, but we have lots there. And then you can do hybrid or fully remote treatment with it, okay? You then will have remote oversight of your patient, so you'll see what they're doing. You'll see what their head is doing. You'll see how the symptoms are mapping to what their head is doing. And you also can send out education to your patient and safety instructions, so you can make sure that before they start, they know exactly what they're doing. I think the videos also allow the patient, you don't remember when you're taking everything in from a therapist on your first appointment, you don't remember what you're supposed to be doing. And a pen and paper, you know, printed out exercises, it doesn't always tell you exactly how you should be doing stuff. So it's very nice to be able to go home and get a reminder of how you should be doing the exercise and be doing it properly. And also I think the clinician can also, they get much richer information from what's happening at home because they get an accurate measurement of it. So that's kind of what the clinician can expect. I think it will make things faster in terms of getting the subjective history out. You can also put in physical assessments if you want to as well. And also just make it easier to prescribe exercises and see what the patient is doing. That's kind of it in a nutshell. And then on to the next slide in terms of what the patient can expect. I think this should make the whole process of vestibular rehabilitation a lot easier for them. All right, so they will have a very easy to use app and sensor, all right, that just fits in their pocket, all right, and that they have their treatment in their pocket. They can do it wherever they want. They don't have to be tethered to any big technology, any, you know, virtual reality glasses or anything like that. They just pop it on and off they go and they do it. They can set reminders. So that feedback we got from patients, I keep forgetting, you know, I'm supposed to do this 3 times a day, I keep forgetting. They can get a reminder through their phone if they wish. They get a how-to of every exercise. So how do you do this exercise? Oh, just look at the video. And then also when you're doing it, you get real-time feedback when you're doing your exercise. So with the head sensor on, you'll be told you're going at the right speed, you're going in the right direction, and then you'll be asked about your symptoms. So you can track your symptoms and you'll see your progress as well. So we have a little progress section as well that they can see the progress. And then you know that when you're doing your exercise, that information is going back into the clinician where they can really adjust and tweak. Add a phone call. You can just say, you know, I often have patients ringing me up and saying, that exercise has just triggered my 3PD. I'm just feeling like I'm really swaying an awful lot more with that. I go, right, let's just drop that for the moment and let's go on to another one. Try this one now. And it literally takes me 20 seconds to do it. So you can tweak exercises and change them a lot more readily than you could if you're waiting for your next appointment. So it saves time for you to, and hopefully gets you better faster. So that's kind of what you can expect if you're a patient or a clinician.
That's fantastic. Thank you for going through what people can expect and what this kind of looks like for people on a day-to-day basis. So obviously Vertigenius is a medical device, and you've described the hardware and software. How can people access this technology? Is this something that they order? Does it go through their clinician? How are people able to get involved with Vertigenius?
Yeah, so it is it's a class 2 medical device. It's not available in the US just yet, but we're going to be there imminently. So it'll be in the next few months, I believe. We're a class 1 medical device under what's called Medical Device Directive in Europe, but we're going to be a class 2A under the Medical Device Regulations, which is the newer form. So we're going through that transition process at the moment. So we are on the market in Europe, and happily expanding here. So to access it, it is prescription only. So it needs to be prescribed, because it is a medical device and there's risks associated with it. It has to be prescribed by your healthcare professional. So
Mhm.
you go to your healthcare professional, they decide you're suitable for it. It can be a doctor, an audiologist, anybody who's suitably trained, and they then will prescribe it for you and follow through your treatment with that. That's how it's accessed. And in the States, I envisage it'll be the same sort of process. It'll be prescribed by your physician or your physiotherapist or your occupational therapist or your audiologist, whoever's expert in delivering vestibular care wherever you are.
Fantastic. So this is something that people will talk to their healthcare providers about, and then once it's available here in the US, work through them. And
Exactly.
it sounds
Yeah.
like it's available elsewhere, which is fantastic. So I have a few questions here from the audience as well.
Sure.
Kim is wondering if this is something that would be helpful for those in long-term treatment. Some of the data that you've brought up has been actually, what time period was the data that you used earlier over, and what effects have you guys seen for more long-term patients?
So I think again it will map to what I think the science says, because it is vestibular rehabilitation therapy. It's delivered via technology. All right. So we know that it doesn't matter when you start, you'll still improve. You just need to get there and get started. And we think that if you start early. So the patients in the first study we took them at any time. They just had to have documented evidence of a unilateral vestibular loss. And the patient with MS were at any stage along the MS journey. They were ambulant though, so they were tending to be a little bit earlier in the process. But I think that vestibular rehabilitation and Vertigenius can be implemented by the expert, at whatever stage of the journey you're at in your vestibular, be you chronic, acute, or you dip in and out of it, say like a Meniere's pitch or whatever. There's times when you need it more, and there's times when you don't need it at all. So I think it's because we know that it's exercise, and physical therapy is all about exercise, education, monitoring, getting people fitter, getting people moving better. So that is good for you at any time point. You just have to get the right exercises prescribed to you.
Fantastic. And so similar to in-person treatments, it can be used for concussion, BPPV, kind of anything across the vestibular spectrum. Is that right?
Yeah, so we have used it in concussion. We've used it in BPPV. Now BPPVs, we know they're one and dones. So the patients that come in with BPPV, they're sorted in a session or two. They don't necessarily need to be going on to do exercises, but the patients with residual dizziness, they're the ones that will really benefit from Vertigenius. And I think over time, we'll be adding in the self cannulate repositioning maneuvers into as well, that will guide a patient through. Whoever's safe to do it, it will guide a patient through doing the CRMs. And certainly all the educational stuff. We know that the YouTube videos for things like the CRMs are not accurate a lot of the time. They're not really being vouched for anywhere. So we would like to have a really scientific way of delivering those to patients as well properly, that they know they're getting the correct instructions to do things like that.
Yeah. And speaking of things like CRMs not being talked about at-home CRMs not being talked about as much, how do you think Vertigenius is going to kind of help not only patients and clinicians in treatment, but then also research and data collection and kind of the future of vertigo research?
Yeah, well, I mean, for me as a researcher, I just really want to know what the dosage is. I don't want to be sending people off doing 35 minutes of exercise when they only need to be doing 10. So that's one of the real benefits I think we'll work out. I also want to know what type of exercise is the most valuable. Do they need to be moving their heads from side to side? Do they just need to be going to the side of the weakness? What is really working best and fastest for these patients to get them back? And what are the predictors? So if we put a whole lot of stuff in, can we predict, yeah, this is the exercise that's going to work for you, along with a medication or whatever? So I think technology allows us to collect really sensitive data about outcomes in a way that pen and paper cannot. So that's where I really see the field expanding and you can see it in the research that's coming out now. We're really learning so much from the amazing technologies that are being developed in this space.
So it really sounds like you'll be able to use this to gain a deeper understanding of what exercises are effective for what patients based on their diagnosis and severity of their symptoms, and then how those exercises impact them. Does that sound like
yeah, and also adherence? That whole question of adherence, like
right.
what is the minimum level of adherence that you need to do, and what's what's optimal for in terms of exercise. We call them the FIT principles. So the frequency, the intensity, the type, and the time. They're the four things that we still are a little bit in the dark about what's the best thing to do. We've learned an awful lot. I mean, there's just amazing research going on. But I think we've still, as always, got a lot more questions than answers about exercises that work and don't work. And also medications. Because remember, a lot of the times we're tweaking our exercise programs with the medications, particularly in things like vestibular migraine and concussion. What's really helping along with your medications Absolutely. To get you over the line and back to full recovery.
Well, fantastic. Is there anything else that you would like to add that we haven't already covered today?
I think so. I think, yeah, it would just be really nice to see these problems solved. It's so nice as a therapist to have somebody walk in the door and know that you can help them. And but I'm only one person, and therapists, there's so few of us. So it would just be really nice to get this out to the wider community that are suffering from these, really terrible cases, problems that are really affecting their daily life. So, and it's just great to see technology now moving into the rehab professions to help us answer these questions.
Absolutely, and hopefully this will help it get out there. And thank you so much, Dr. Meldrum, for joining us today. It was an honor to have you here. Thank you for your great answers to our questions and for telling everybody how we can access this. And we'll look forward to it coming over here to the US soon, too.
Thank you very much.
Absolutely. Thank you very much for your time today.
It was an honor to be here. Thank you very much.
Have a great day, everybody.
Go to vestibular.org for more videos like this one. Also there, you'll find information, support, and encouragement to help you find your journey back to balance.